For patients receiving workers' compensation and suffering with low back pain, spinal fusion surgery leads to poor long-term outcomes. Compared to non-surgical treatment, spinal fusion surgery results in a lower rate of returning to work. The authors conducted their study using Ohio workers' compensation data. Lead author Dr. Trang Nguyen and researchers identified 725 workers with chronic lower back pain who subsequently underwent spinal fusion surgery. Spinal fusion is a procedure done to fuse together adjacent vertebrae to correct certain types of chronic back problems. Most of the patients in the study had degenerative disc disease, herniated discs, or nerve root disease. The researchers assessed final treatment outcomes such as the ability to return to work, disability, and the use of strong pain medications at 2 years follow-up. The researchers compared the results of spinal fusion with those in a random sample of 725 patients who underwent non-surgical conservative treatments like physical therapy and exercise. Nearly all categories of outcomes were worse for patients who underwent spinal fusion. Only slightly more than a quarter of spinal fusion patients were able to return to work, compared to 2/3 of those treated without surgery. 27% of patients in the spinal fusion group had to undergo surgery more than once, while 36% also experienced some form of complication. Though the study is not a controlled scientific trial, it raises questions about the long-term effectiveness of spinal fusion surgery for chronic low back pain. Dr. Nguyen concludes, this procedure is offered to improve pain and function, yet objective outcomes showed it increased permanent disability, poor return to work status, and higher doses of medications.